What's up, you guys? My name is Miguel, giving you your daily dose of radiation. Today's video, we are looking into the documentation side of Xray. So, to give you context, I'm a night shift Xray tech. I've been doing it for about 4 years. So, our field is completely a little bit different versus other fields in the medical world. My lady's a nurse. I have other family who are ultrasound techs, MRI techs, physical therapy, and other various aspects of this medical world. And I would say out of all of them, we have it the easiest, I would suppose, compared to all of them. And most techs will fall into one of three categories. There's option one, the simple, whatever the order says, copy and paste. That's all you do. Like if it says chest pain, that's all you put on the order and you keep it pushing. There are certain techs that's all they do. The quote unquote bare minimum, right? And then there's the middle level of techs that you put like the basic chest pain, and then you'll ask the patient, hey, what's been going on? What made you come in today? Da, 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 da. And then when they go back into the order, they'll be like chest pain times 3 days. That'll be another one. And then there is the final tech, which is the one that goes above and beyond and does all the proper and like highest documentation. So you get both the chest pain, how many like x-rays or like the history of the patient of why he's getting the x-ray done, and then prior chest x-rays, and then looking into the patient's chart and seeing if there's any history of other stuff, other diagnosis or other stuff like that, and then being able to document like if the patient was shielded, if the patient was pregnant, if like the patient was, why you weren't able to be able to get optimal images, and like do a good amount of documentation and stuff like that. Which all three of them, to be honest with you, they're all in a way acceptable. I would say you should probably you should strive for 3 for the last one that goes above and beyond, but sometimes due to the volume and due to the excessive amount of stuff that's going on, you don't always have time for 3. 2 is probably what I would fall into, where you get what the doctor, why he ordered it, and then why the patient, like what's going on with the patient. That's probably like a good sweet point to be in, because I know sometimes you'll get slammed with so many orders and it's hard to, go to number 3 and do that. But 3 will always protect you from like all legal stuff, and like be able to make sure that if you go back in like 5-10 years, Lord forbid, you get dragged into court from some like legal stuff, this one will always protect you from everything. So proper documentation is very important, especially if there's a reason why you weren't able to get optimal images or stuff like that. I personally have a special little keyboard I use that has certain inputs that are like the most common stuff I do. Certain places let you bring stuff to work, other places don't. I have a special little keyboard. It has like 6 or 7 little buttons, and each little button is for a reason. So like one of them, like I'll click it and it'll say like chest pain, and then other ones will say shortness of breath. Other ones will say patient was pregnant and was shielded. Other ones is like, what's another common? Unable to get optimal images due to pain. Patient refused the exam. Like there's certain stuff that happens so often that I have it, so it just makes it easier to document. I'll just have like one little button, I click in it and it types it out. That could save you, and it makes it easier in your job. And it can only be good. The more notes, the better. We don't go above and beyond as like the nurses document so much stuff. It's wild. My lady will tell me all the time all the stuff she has to document and reaching out to doctors and doing a bunch of things. It is a headache. So like when we compare documentation notes, we are literally like 1/10 of what they do. It's wild what they do. The most you'll probably do is if you do fluoroscopy and you have to document like the history of the patient, the amount of radiation they got, what kind of substance we gave them, like medication, like barium and other stuff like that, and charging for contrast, and where it was performed, who did it. That's probably like the most beefiest and the most amount of documentation you'll probably do is in the main department when you're doing fluoroscopy. So yeah, it's been your boy Miguel. See you on the next one.